Hello everyone, welcome to OET Answers. In this video, I'm going to tell you how to write a better perfect letter. Usually, in the time of examination, you will get 5 minutes to read the case note, right? So, same like you will get 5 minutes time. So, during this 5 minutes time, you have to prepare your mind how to write a letter, what are the things we have to consider, how to apply this information, and how is your organization status, everything you have to make sure about it, right? So the same thing we are going to do on this video. So think that you have 5 minutes time in your hand, right? So first, what you will do, first we will make sure about nurse's role or your role or my role. Okay, so here read the case notes below the complete the writing task which follows. Miss Cassandra Kinser. Cassandra Kinser is a patient name, 32-year-old patient, and the patient is in the medical ward which you work. So you are a nurse working in the medical ward. So you got your role, right? Followed by that, what you will do? You can move to the writing task. There, using information given the case notes, write a referral letter. So you have to make sure what type of letter you get. Okay, so once the letter word like a discharge, referral or other things, it seems anything, don't immediately determine this is that kind of letter. Okay, try to read the entire tasks completely. Okay, means the writing task which includes information of write a referral letter to Cassandra Kinser, right? So Miss Kinser's general practitioner, there you can see apostrophe S. So Kinser's general practitioner, so you can identify what type of case we have, right? Then Travis Run, so that a general practitioner name called Travis Run at the Pont Road Medical Clinic, 172 Pont Road, Mosman. Okay, so for further medical evaluation, for what we are requesting for further medical evaluation, almost you got the point in the writing task. Then come back to the remaining details. Okay, just grab the remaining information. You can see the hospital information and the patient details. So in the patient details, patient's personal details they have given along with admission date and discharge date, you can see, right? So that both dates are same. In the admission, what are the things happened, what was the patient's problem, and how did the patient treat? Okay, everything they have given. Social background, past medical history, diagnosis, patient's progress or the medical progress, nursing management, and finally assessment including discharge plan. Everything they have given clearly. So you have to categorize the information and you have to write it properly, right? Okay, so first what you have to do, once your 5 minutes time up, what you have to do, first you have to put the date. Okay, how the date would be, it might be a last date or today's date or the discharge date. Okay, so any of the recent date we have to apply there. So there you can see the discharge date, followed by that leaves 2 lines space, that's enough. And we have to write the letter, means we have to write the letter. There we have to include what, address part of the recipient. So recipient address you can see on the writing task, right? So you can write as per the proper official manner, you can write the address part. Then followed by that, what you can say, so we are writing letter for Dr. Travis or general practitioner. Any of them can be written. So dear practitioner or dear Dr. Travis or dear Dr. Wren can be written, right? And after that we have to write the patient name and the patient's age, or sometimes date of birth will be asked. Okay, that we have to write. And so now we are going to write the important part, that is the introduction. So when the person see your introduction part, that they will get the complete clarity of the introduction part or the patient's condition, right? So what type of letter? In the first line, what you have to write? First you have to show that this is the known case or unknown case, or this is the discharge letter, referral letter, transfer letter. So any of them. So in the first line, what type of letter that you're writing, that should be there. Like I'm writing to refer, I'm writing to discharge, I'm writing to update the current health status of like. Okay, so for known case, the concept, right? Is how we have to write it. Then followed by that, you will introduce the patient. So I'm writing to refer Miss patient name. The full name we will be written in the first paragraph, and followed by that, what is the patient problem and what is the patient's current requirement. Everything we will write in the first paragraph. If the patient is being discharged means you can add that information in the first paragraph. Okay, so when they read the first paragraph, they will get all information. What type of letter is this, to whom we are referring the patient, and for what's the purpose of the referral, and when whether the patient is getting discharged or not, or what is the current scenario of the patient. Everything we have to give clearly as a picture in the introduction, right? In the second paragraph, what are the things we can include? So the diagnosis. So in the introduction already we have written, correct? Then about the requirement, where you can see the requirement, you can see in the writing task. If there is no information regarding the requirement writing task, what you can do, you can see under the discharge plan. So there they have given follow with GP. So GP, that same GP only they have given in the writing task. So follow can be written. Problem you have mentioned, requirement you have written, all information included in the introduction. So second thing is complete all about admission, when the patient got admitted. So what's the date? Both the discharge and admission both even happened today only. So today patient get admitted to hospital. Then what happened? Followed by the admission, what is the next event? Okay, don't disorganize the sentence. Okay, so the events should be there sequentially. Okay, the chain of events you have to write there. You are not supposed to change the events or in between fixing the events. Nothing you can do. Okay, first admission means you have to write the admission. And what's the reason for the admission? Secondary, you can write the symptoms or the problems the patient's facing actually. Then what you can write? Problem you can see under the admission diagnosis, right? And after that, what you can say? So what is the diagnosis? Already, if you mentioned in the introduction means no need to repeat that. But if there are any presenting complaints are there, that you have to write in the means patient was admitted to hospital and was diagnosed with lip laceration and one more problem. But if you notice, admission diagnosis was lip laceration, right? And as well as what's the problem? She has a UTA they have given. But if to this area, discharge plan, still the appears infected urine. Okay, so patient's urine infected, which means one complaint resolved and one complaint needs to be treated. So how can you write that? You have to give the proper difference. Okay, so admitted information we have written, when the patient admitted, for what patient admitted. So the complaints we have given and already diagnosis made, so no need to write again. And what are the treatment as a nurse you have provided, and what are the prescriptions she has been recommended. Everything we have to write in the second paragraph. Okay, so body, in the body paragraph you can write. Under the admission diagnosis, you can see abdominal pain, burning with the urination, and it lasts for several days. These are the things are complaints that you can write. Then what are the care provided by the nurse? So for lip, doctor has prescribed some of medications. For UTA, they have given only follow up with the GP. So which means UTA needs to be considered hereafter. Okay, so almost your point, you got the point. First, you will write the when admitted, what are the complaints of the patients and what was the patient's diagnosis. If repeated means no need to write again. Then what are the care the nurse provided and what was the prescription of patients, everything you can write. And currently at last you can write the progress. Okay, progress, how the patient progress, whether he is active or he needs to be treated something else, whatever things they have given, that you can write. Then already this is the noun case, so no need to write the social history. You can just exclude the social information. And so come to the final paragraph. There it would be appreciated, discharge paragraph, right? So in the view of above, it would be appreciated, you will write. And what you will do there, what? So patient urinary tract infection or infection in urine needs to be treated. So, and what else? You can copy all information from the discharge plan, but whenever you're copying the information, make sure that you're writing the letter to the known case or you're writing the letter to the doctor or higher superior person. So what you can write? Okay, there are some recommended things only you can write it. So appointment made at a sexual health clinic, that you cannot write If you want, you can just please note she has this appointment, or that you can write. Then follow up with GP, that only we have requested. Monitor antibiotics. Doctor will not monitor the patient's antibiotics. Okay, so if you want, you can just mention that she has been prescribed this other medication. That's all. So no need to ask the doctor to do monitoring and other things. Okay, these are the things that comes under the nurse's responsibilities. Then urine appears infected, treat for UTI. So for UTI problem only, we are referring the patient to the general practitioner. So general practitioner has to take this into considerations, and he has to treat the problem of patient, right? So these are the information we can write in the discharge information. Finally, please contact me for any questions. Yours sincerely or faithfully, registered nurse can be written. Okay, so what is your role? That you can copy. These are the information that you have to do when you have 5 minutes in your hand. Okay, so first, where is the date? Then what is the recipient's detail? And what are the remaining information sorted out that you have to write? Then introduction, what are the information included? Body paragraph means what is the exact hospital admission to up to recovery. Okay, what are the things you have provided during the hospital? What are the care you have provided? That only comes under the body paragraph. So if there is a known case, no need to write the social and past medical history. If there is a new patient, means that you can write. And finally, discharge. So what are the information or what are the things patient needed, that you can write. But for recipients, according to recipients designation only, we can write all the things. Okay, so this is about the letter. Okay, for further questions, you can drop your comments in the comment box. Thank you.